Greetings to the evaluator. This is Team Medilink, and our goal is to store and maintain health records for Kerala migrant workers. Here we have a tutorial guide for users with low digital literacy rate to change their language of their choice. Here I choose Malayalam, and now the site is in Malayalam along with the guide. So now the next choice would be to go to patient login. Here is the patient login along with the translated guide. I can revert back to English if I want now. After we revert back to English, we can use the digital KYC to complete our Digilocker verification. The Digilocker will redirect it to its site where we can enter our phone number without even entering our PIN to allow access to documents. The documents can only be accessed when an OTP is provided. After I enter the OTP and it is authenticated, then all I need to do is allow access to my Aadhaar card. After that is allowed, our site will then fetch your details on the basis of that Aadhaar card. Your details will then be fetched and shown to you, where you can just confirm with your email address. If your account is already registered, then you will receive an error. In the pre-assigned values, we have set the last 4 digits of the Aadhaar card, the name, and the password of the user. That's it. And now in the dashboard, we have values such as the diastolic systolic weight, the prescription, the appointment schedules, the current medication, disease history, and patient notes. In the My Prescriptions, you can upload any previous prescription you have. Suppose the old prescription looks like this. All you need to do is process the new prescription into our website. Upload the PNG. The PNG will be uploaded to our cloud for safety, and it will be transcribed by our guided LLM with OCR to store the details in a very beautiful manner so that you don't face trouble in finding that prescription ever again. Here, the prescription is processed and all the details which are present in the prescription are provided. Then, the details are extracted into a JSON format for you to use. The details are also added into the prescription. Now, we also have the current medication system, where you can turn any medication into past medication or past medication into current medication, so that the doctor knows what medication you're currently having and your disease history. Along with this, you can generate a health summary which is comprehensive and useful to you so that you don't face any trouble to understand what is going on. Now, you can also write patient notes to specify if you have any other issues, like you're allergic to peanuts. Besides this, if you want, you can always schedule an appointment with the doctors that are present. With this, the patient side is done, and we can go to the doctor side. Now that we are logged out from the patient side, we can always use the doctor sign-in. Here we have a pre-assigned value, which is an MNC verified doctor. The doctor can then use the guide to help himself with the portal, or he can check out what are the details present. Here is Priyanshu Upadhyay, who is a critical patient under treatment, and the upcoming appointments of patient Rishank Raina, through which I had done the Digilocker verification. I can search any patient which is present on the website. I searched myself. Here is the disease history of me and my prescription and my daily vitals. I can add any medicine present. Along with it, I can also link that specific prescription to the disease that is present without any issues. Here is the disease history. You can add any disease according to the location of the present history. Now, if you have any doubts as a doctor, you can just ask our health records. And our AI will use the comprehensive digitally create a summary in real time. Besides this, if you have made any changes, such as adding the medication, you can just send an email delivery report to the patient. After the AI report is generated, all you need to do is check your mail for the report which was received. You can check the details of the history here. Now, besides this, the doctor also has the power to change any medication which is currently present, or even edit any disease history doctor side. Besides this, we have services like AI disease analysis, where we can add any skin disease that is present, and based on the ML model which is developed on CNN, we can decide what disease it is. We have an AI symptom analysis which takes your specific symptoms and predicts what type of disease you might have. Within seconds, the potential diagnosis is made. We also have an hotspot map to prevent any diseases that is present. Here, we can see that if we go to COVID-19, an hotspot map appears. It means that there might be patients who have COVID-19 and have been diagnosed and found here on the basis of their location. We also have process prescription, which we just saw in the previous video of patient side, and emergency center, where the doctor can enter the patient's contacts, system doctors and system hospitals, or the patient can also do them themselves. This is Swift Medilink, and this is our project to store and help migrant workers to maintain their health records with ease of use. Thank you.
Hey everyone, today we are going to see the mobile version of Swift Medilink. Now let's get started. This is our landing page where you can see the number of registered patients and the number of patients being treated and the number of patients discharged to show the impact we make. This app has been specifically made in view of the condition of Kerala migrant workers, and we have added a multilingual feature especially for them. Now, as you can see, this is all transformed into Malayalam. This is the patient sign in button. Once you go in, there are two buttons, sign in and sign up. The sign up button does sign up via Digilocker. Here you can see when I press this button, I go to Digilocker in WebView mode, and once I am done with this, my data will be saved in the backend, and then I can sign in. So to keep it secure, you do not need your whole Aadhaar card. You just need the last four digits of your Aadhaar card. Now, once you have signed in, see the data is still in Malayalam. The Malayalam data has been cached into your mobile memory, so every time you open it, it does not load again, and it's very light on your mobile. Here you can see your health data, prescription stores, hospital visits, and let's switch back to English for convenience. Here you can see a AI-based health summary. You can add your daily recordings, current medicines, past medicine, and the disease history. When you press the See More button, you see a very detailed version of your disease history. At the end, you can add patient notes like you're allergic to peanuts. Let's log out and take a look at the doctor sign up site. Here you can sign up from NMC API ID. You need to have a valid doctor ID from the National Medical Commission to verify in this app. And once you're done, you have to sign in here. Once you have signed in here, you can see the patients you are treating and also any other patient which you want. So it is for the ease of the Kerala migrant workers, so they can visit any doctor without any issues. And once you have searched the patient name, here the data of the patient has been fetched. Here you can see the prescribed medicines. You can even prescribe medicine from the doctor's side, the disease history, the health trend, and the patient notes. Here, I am allergic to peanuts is a very important thing if the doctor does not know what you want. And at the end, there's an Ask AI feature which lets you ask questions to the AI to save time.
So this is our Swift Medilink. Thank you.